All right, in this video here, let's use our Anatomage table to take a look at some of the heart anatomy. As you can see first right here in our picture, we have the pericardium highlighted, what looks like all in white right here. This is that pericardial sac, this connective tissue layer that surrounds the heart itself. You don't want fluid to accumulate inside of this sac around the heart. You're going to put pressure on the heart. If you put pressure on it, it won't be able to fill with blood, and if it can't fill with blood, it won't be able to pump any. It's what's called cardiac tamponade, which can be deadly. But let's remove it right there. That way we can see the heart a whole lot better. And let's look at some of the structures like our atria. And here we have our right atria highlighted. Notice not only is it on the right side of the heart with the right pump, but it's also a little bit more anterior to the front. So you always think of that right atrium, a little more to the front, left one a little bit more to the back, but we usually go with just right and left. Remember, the atria are the upper chambers. These are little primer pumps that push a little additional blood into the ventricles after they've mostly filled. So if we look at our left atrium, you can see most of it is to the back, posterior. Then we got our ventricles. Notice how the right ventricle is mostly to the front and the left one's a little bit more over to the left and posterior to the back. But these are our power pumps. That right ventricle is what pushes all that blood from the body into the lungs, and then the left one does just the opposite, out of the lungs and out to all the body. We got a few of our valves to the inside. The tricuspid on the right side separates our right atrium from right ventricle, always preventing backflow, just like valves always do. Then we got our pulmonary semilunar valve at the base of the pulmonary trunk. When that right ventricle pushes blood through that pulmonary semilunar valve, goes through the pulmonary trunk, splits out through the pulmonary arteries, and that blood will circulate through the lungs. Over on the left side, we have our mitral valve, also called the bicuspid. Now, this valve right here separates left atria and left ventricle, again, always preventing backflow. Then we have our aortic semilunar valve right there at the base of the aorta. Let's take a look at some of these other structures like the pulmonary trunk. Again, this is what the right ventricle pushes blood through. When you get to the top of that trunk, it splits into right and left pulmonary arteries, which goes out towards the lungs. And you can see all the smaller arteries and veins associated with those. Here next we have the ascending aorta. This is what the left ventricle pushes blood up through, go through the aortic semilunar valve, out the aorta. In the next section, the aortic arch. And if you look here at the aortic arch, you can see the aortic arch has several sections to it itself. The brachiocephalic artery comes over towards the upper right part of your chest and supplies blood to that right upper limb, right side of your head and neck. Then we got the left common carotid coming up the left side of your neck. The right common carotid comes off that brachiocephalic. Then there's that left subclavian. So there we see a lot of these structures here coming off of that aortic arch. Then we have the descending aorta. Descending has thoracic and abdominal sections with many arteries coming off of it. Here's the superior vena cava. Returns all blood from above the heart back to that right atrium. Inferior vena cava returns all blood from below the heart back to the right atrium. And of course, inside that right atrium, there's a third inflow called the coronary sinus, returning blood from the cardiac muscle itself. Here are pulmonary veins, right and left. Remember, when it comes to arteries and veins, arteries of the body will be high in oxygen and low in CO2, and veins are just the opposite. But then the pulmonary are reversed. So again, where most all arteries are high in oxygen and low in CO2, the pulmonary veins are just the opposite of that. So that pulmonary artery and vein circulation is different whenever it comes to the quantity of the oxygen and carbon dioxide that are in them. But there also are inferior pulmonary veins. Looking at some of our coronary arteries right here, there's our right and left. Those are the two branches that come off of that ascending aorta, and that brings blood right back to the cardiac muscle itself. Down here a little bit lower, we have our posterior descending, same thing as interventricular artery. Here we have our circumflex over on the left side. There's our anterior interventricular. Again, anterior is on the front, posterior is on the back, and interventricular tells you that they're in between the ventricles. There's our right and left marginal, which are on the margins or the side of the heart right there. And then, of course, again, we can see some like the carotid arteries and a few others of the thorax like subclavian, brachiocephalic, and so on. So there's a good little video of some of our heart anatomy and some of the closely associated blood vessels associated with it. We'll continue with more of this in another video.